Hey guys, Swen Sandberg, physical therapist with Yada Yada. Have you been told you should strengthen your core to help your back pain? Oftentimes when patients come in thinking that physical therapy is all about core strengthening and have questions about the core strengthening exercises they should be doing to improve their back pain. Now, this is true, core strengthening can help with low back pain. A lot of times, however, it can also make back pain worse if we begin too aggressively or if we start with activities like maybe sit-ups or other aggressive strengthening routines that maybe flare up the back. So really what I like to teach my patients is 5 exercises. I call them the big 5. And these exercises are awesome because they keep your spine pretty much neutral the whole time, and they're great at activating all the muscles that help support your spine and can potentially give you some pain relief. So let's dive right into it. I'd like to show you these 5 exercises, explain how to do that, and then give you the reps and sets that you should be doing at home. All right, the first exercise that I like to do and have patients do, especially if you're experiencing some pain that's maybe more like subacute or chronic, the pain seems to have settled a little bit but is lingering. This exercise is always a good one to start with. It's a simple hip bridge. Essentially what you're going to do is you're going to start driving your heels down into the table. So I've got a little bit of pressure, my glutes begin to fire, and I lift the hips up and back down. Now if I wanted to make that harder, I could lift my arms up and that would be fine. Typically, I like to leave them down, gives you a little bit of support. This motion, again, should feel good, should not irritate your back pain. And down, okay? Again, you can see in this, when I come up, my spine is neutral, and back down, okay? I'm not letting it sag or arch too much. I'm just keeping it nice and neutral. So one more, nice and neutral. I'm squeezing that bum cheeks and I'm pushing my heels down in the table and then I relax. You should do this anywhere between 20 and 30 reps. You can split that up into 3 sets of 10 if you'd like. The next exercise I like to have patients do is a modified plank. A modified side plank should be done from the knees, should be propped up on your elbow. The elbow should be under the shoulder, so help cut down on any shoulder discomfort that you might get. And then all you're going to do is you're going to come up and forward. Again, you can see my spine is nice and neutral. I haven't twisted or turned, not flexed or bent back excessively. And then I come back down, okay? Now, typically, I recommend that when you come into the side plank, that you try to hold it for 10 to 15 seconds. And then as your strength and your tolerance builds, then you can start holding it for 30 seconds or so. But I'd work into that. Now, I do not like beginning with the legs straight. Part of the problem is people can start to sag here, starts to get uncomfortable, and it's just harder to do. So when we're trying not to irritate that back, but strengthen the core, I find that this is the better option, okay? The third exercise is a bird dog. You're gonna wanna be on your hands and knees. You're gonna want a nice flat back and a slightly tight tummy. You're gonna straighten one leg out behind you and the opposite arm out in front of you. And you wanna try to keep that pelvis pretty flat. I should be able to put a glass of water right there and it would stay and not fall off. And then of course you do the other side. And I would recommend holding for about 10 seconds if you can. The next exercise, or the fourth exercise, is a forward plank. Now again, based on your irritability, it may be best to start on your knees. And I recommend this for all my patients. Regardless, I want them to be able to focus more on engaging the core than engaging their hip flexors. So I think the knees is a good place to start. And again, you want that nice flat back like a tabletop and hold for anywhere between 20 and 30 seconds. And I'd repeat that about 4 times. The last exercise is a modified curl. Now, it's going to be a little bit like a crunch. But to protect my back and keep my spine neutral, I'm going to put my hands underneath my low back. I'm going to straighten one leg. This keeps my pelvis neutral and helps me engage my lower abdominals. And then I'm going to lift my elbows up off the table and I'm going to curl up slightly. Now, you notice I get a little shaky. I should probably work on this a little bit more. And back down. Being shaky is absolutely normal. That will improve with time. But the key here is it should not hurt. If you're getting pain with this, you may need to back off this exercise, but very rarely do I have a patient that complains of discomfort or pain here. And up and down. Now I would hold that about 5 seconds. 2 to 5 seconds is pretty average, and I'd repeat that anywhere between 10 and 20 times. So that's the big 5. When you look at the literature, Those are the ones that are really backed up in the literature, and they're also the ones that don't tend to irritate patients who are trying to get into a core strengthening program. As always, if the exercises seem to be increasing your symptoms, clearly you're going to want to work with a qualified medical professional to come up with a different plan or to advise you on how to perform the exercises correctly. Thanks.